Hi, it's Maria here from Women into Wellness. In this video, I'm going to be talking about the symptoms of diastasis recti, so what to look out for in order to know whether you think you may have diastasis recti. So stay tuned for that. Welcome to my channel, Women into Wellness. This is where I provide you with tools, tips and strategies pertaining to movement, nutrition, mindfulness and lifestyle to generally help you feel fantastic and maximize your potential for wellness. So today I want to talk about the symptoms of diastasis recti. Now, if after you've watched this, you want to actually do a diastasis recti check to discover if you have diastasis recti, then I have got another video that will walk you exactly through the check and how to do it. That is linked below. If you also discover or think that you have one and you want to work out what you can do to heal it, I have a course for you, which I will talk about at the end of the video, which will help you heal your diastasis recti safely and effectively. So let's get into the symptoms of diastasis recti. When you have a diastasis recti, it means the muscles of your core are compromised. Now, we have to think of the core as this whole integrated aspect of different groups of muscles. We have a front, a back, a top and a bottom. Now, the front is going to consist of that rectus abdominis, also the obliques, which do wrap around the side, and we're going to talk about the transverse abdominis, which goes all the way around. That links us into the back muscles as well. So you have the muscles of your lower back, particularly, that help you maintain that upright core. We then have the top of it, which is the diaphragm, which is what allows you to do your breathing, and then underneath the pelvic floor, which supports all of the organs and which allows you to control the passage to a degree of all of your excrement, so whether that's wee or poo. So it's really important to think about it as a whole. Now, when you have diastasis recti, one of the symptoms is that you're not able to manage this internal pressure because one part of the core, it's like having a weakest link, right? So one part of that core is not working effectively, and it's actually then sending pressure out through the pelvic floor. Now, this can put undue pressure on the bladder, causing the bladder to not be able to control itself when it needs to, and therefore causing dribbles, urine drips of wee. So a symptom might be that you are experiencing urinary incontinence. It can also relate to fecal incontinence, but most likely and in most cases, urinary incontinence. So you're peeing your pants when you don't want to, whether that's because you have just coughed, sneezed, laughed, run, walked somewhere, or just because your bladder feels full. So that's one of the first symptoms. If you keep having that, then start to think about whether you might have a diastasis recti, and you're going to want to do the diastasis recti check in the video that I have linked below. Another symptom for diastasis recti is going to be the persistent mummy tummy. So if you have had a baby, you've gone through postnatal recovery, and you're sort of that period of time after it where you feel like you shouldn't really have this big belly bulge anymore, or it even looks like you're still pregnant, or people have asked you if you're still pregnant. This actually happened to me months after I'd had my baby, in fact a long time after I had my baby, and my baby was actually even there. Then trust me, this could be one of the indicators. And of course, the reason for that is because the diastasis recti is letting everything hang out there in the front. You've got the posture perhaps being offset by it as well. Now, another symptom is going to be that you have a weak core. Now, a weak core will mean that it's not able to manage pressure and load in the way that it should. And this is going to manifest in terms of you feeling like you are not able to do sort of general activities of daily living without struggling. So this is any activities that involve your core being the primary driver of that movement that you're doing. So whether you're picking up your kids up off of the floor, or you're lifting and raising them up over your head, your core is doing a lot of that work. Although you may think your arms are doing the work, your core is doing a lot of stabilizing work, and it's helping you lift, maintain that postural alignment correctly. So it could mean that you find it a struggle to do those activities. Now, if we look at it in a really direct way, then we could be thinking if you're doing any sort of movement where you are sitting up that really relies on the core doing most of that work, and you're struggling to do any sort of movement where just sitting up out of bed, I'm not even talking about an exercise routine involving a lot of sit-ups, because if you have a diastasis recti, that's one of the type of exercises you will not be doing lots of if you're looking to heal it, especially in those initial stages. But if you're just doing something like you're laid in bed and you reflexively want to sit up and you're finding that a real struggle, that could also be an indicator. So an indicator of weakened core could be because you have a diastasis recti. Now, another symptom may be that you have constant back pain. Now, this links into what we were just talking about, the core, and the reason for that is when you have a weak part of that whole 4-part core, another part is going to be affected. It might be overcompensating and doing some of the work that the other muscles should be doing that they're not able to do. So that would be some of the abdominal muscles not being able to hold up your core, not being able to help you lift load, not only body weight load, but external load, whether that's picking up a kid or picking up a bag of shopping or a piece of furniture. And it also means that not only are they overcompensating, but they are often pulled out of alignment, most importantly, because that front part of the core or the wraparound part of the core is not quite doing the work it should to hold you up and erect and in the right place. And this is caused between the muscles being overstretched when they should be slightly shorter and tighter and stronger, or perhaps being over tight in some places when they should have the ability to stretch and relax. So it's about creating a muscle between the balances. So having poor posture, particularly with diastasis recti, through the pelvic girdle, so this is where you have like an anterior forward tilting of your pelvis, it tilts forward, is a good indicator. It's one of the symptoms that you may have diastasis recti, and it basically is an indicator that the front muscles here of the abdominal wall are loose, lax and overstretched, and the opposing muscles in the back are tight, contracted, and they're generally stronger, and they are holding that pelvis in that position. It also means that you're going to have tight hip flexors. So this is the point where your thighs meets into your pelvis. So the hip flexor at the front is going to be tight as well. You need to loosen that off. And then conversely, in relation to that, the balancing opposing group of muscles being the glutes, your butt muscles, are going to be weaker. They are going to be stretched, they are going to be soft, and they are not doing what they should to be able to tilt that pelvis back up into an upright neutral position. So if you find that you have this posterior tilt of the pelvis, which is, known in a professional sense, it's known as lower cross syndrome, then that could be a good indicator that you have diastasis recti. And another symptom of having diastasis recti, which is often overlooked, is that it can contribute towards you having a really poor breathing pattern, breathing technique. Now, this is often overlooked simply because breathing is just something we take for granted, right? Most of us are luckily able to breathe on our own on a daily basis or have a healthy respiratory system, but often the breathing pattern can be overlooked. Now, if you have a diastasis recti, as I said, what is going to cause is issues with that abdominal wall and with that whole core as a reflexive core, right? We talked about the 4 different parts of it. So you think the diaphragm is at the top. If you are blowing out and breathing into your belly because your abdominal wall is not providing any pushback, then you are not only making your diastasis recti worse, but it's also going to create for you an ineffective breathing pattern. So you're not going to get the most out of your breathing that you should be getting. We should be breathing laterally into the back and into the sides of the body rather than breathing into the belly. But what happens when you have a diastasis recti is there is a tendency for the airflow, the pressure of that airflow, to be forcing out through the front wall rather than laterally and into the back of the rib cage. So if you notice that you consistently are doing belly breathing rather than rib cage breathing or thoracic breathing as we call it, lateral breathing, 360 breath, then also that could be a symptom of diastasis recti. So we've looked at a lot of the symptoms for diastasis recti. Like I said, if you feel like some of these are you may have one of them, you may have all of them, then what you're going to want to do is do a diastasis recti check. You can self-check this yourself. I have created a video for you on how you can do it, exactly how you can do it, what you're looking for, and then at what point you would know what to look for and what to check for to know whether you are healing your diastasis recti, and then when it is healed, to a reasonable degree, then check out that video link below. And if you are looking for a solution for your diastasis recti, you want the holistic approach. Holistic always gets you the best results, because one thing in isolation will not get you there. It will not get you the ultimate transformation. Then check out my Diastasis Recti course. I have linked it down below. It takes you through the 7 vital lifestyle changes that you need to be addressing in order to heal your diastasis recti. These are all broken down into bite-sizable, manageable chunks that are easily embedded into your daily life to help you achieve the results that you really need in order to manage and also reduce that diastasis recti, to heal it to a functional level, and to finally be rid of the mummy tummy. I hope you found this video useful for you. If you have, please go ahead and share it so that other women like you can benefit from the information here, because it can have lifelong implications if you don't sort out a diastasis recti now. It will consist and stay with you persistently, especially if you're not addressing some of the things that can help you fix it. So thanks for watching today. I hope to see you soon, and until then, I wish you well.